Hi there, my name is Dr. Nicole Siegfried. I'm a licensed clinical psychologist. I hope you find this video helpful.
Navigating mental health care can be confusing if you aren't familiar with your options. A variety of different mental health services are available. There's also a range of different treatment providers with various specialties and levels of education. So who can provide both a diagnosis and effective treatment, including psychiatric medication? There are many pathways to finding the care you need. Many people begin with outpatient therapy and start exploring medications when some of their symptoms persist. Others may start with a partial hospitalization program or day treatment program that includes psychiatric care. Then they could search for an outpatient therapist and psychiatrist to provide continued treatment at a lower level. These are only a few examples out of the many possible directions a mental health treatment journey can take. Each person's needs are different. Your options may depend on what's offered in your state or what your insurance will cover. Today, we'll cover the different medical health professionals who can prescribe psychiatric medication, and we'll learn about some of the differences between them and where you can find them. So first, can a psychiatrist prescribe medication? In short, yes. Psychiatry is a branch of medicine that encompasses the evaluation, diagnosis, and treatment of mental health disorders. Psychiatrists are medical doctors who help clients manage both the mental and physical aspects of these conditions. The treatments they provide can include medication, behavioral interventions, and therapy. Psychiatrists can treat complex and co-occurring mental health conditions. They can help clients manage their psychiatric medication as well. So, can anyone else prescribe psychiatric medication? The prescriber on your care team may depend on the complexity of your condition or the severity of your symptoms. For instance, many general practitioners and family doctors are qualified to prescribe medication for anxiety and depression. In contrast, a client who has both or a more complex condition like bipolar disorder may see an outpatient psychiatrist. Other clinical professionals besides psychiatrists can prescribe psychiatric medication. You may work with them through treatment centers like mental health clinics, hospitals, and residential treatment programs. Psychiatric nurse practitioners sometimes work alongside psychiatrists, or they may see clients as part of a multifaceted treatment program. So let's go over each of these in a bit more detail. Again, psychiatrists. A psychiatrist is a medical doctor who specializes in mental health, including substance use disorders. They can diagnose conditions, prescribe treatments, and help clients manage their medication. A psychiatrist must have either an MD or DO. Next is psychiatric nurse practitioners. Psychiatric mental health advanced practice nurses have a graduate level doctoral nursing degree. Though they are not medical doctors, they can perform many of the same functions as psychiatrists. Their titles and responsibilities can vary by state. Next is primary care physicians. General practitioners with experience treating mental health conditions can prescribe some medications. They may refer clients to a psychiatrist for more specialized treatment if they have a complex diagnosis or more than one condition. And next is physician's assistants. They're clinical professionals with advanced degrees who can also gain experience with psychiatric conditions and treatments. So you might be wondering, can my therapist prescribe psychiatric medication? Most professionals who primarily provide therapy are psychologists who have studied mental health conditions. However, they don't usually hold medical degrees. They may have advanced degrees like a master's or doctorate in psychology or social work. These degrees address the mental aspects of mental health, but they don't typically include extensive coursework on brain chemistry, psychiatric drugs, or physical health. So what questions should you ask your prescriber? It can take some time to find the right psychiatric medication or combination of medications that works best for you. Some types of medications can start working within minutes, and others can take weeks or a couple of months to produce results. Depending on the medication, you may notice some minor side effects. These often go away once your body gets acclimated to your medication, but in some cases, they can be serious. Talk with your prescriber to get a clear understanding of what you can expect and what to do if you start experiencing side effects. Some questions that may help guide your conversation are: how will we determine if I need psychiatric medication? What kinds of medication can help with my condition? Which medications do you recommend for me, and what dosage should I start with? What side effects should I look out for, or what should I do if I start having side effects? How will I know if my medication is working? And what's our plan for long-term maintenance? Searching for care when you're in need of help with mental, emotional, or behavioral difficulties is hard, but you deserve to work with compassionate professionals who can provide effective treatment. At Lightfully, we take a balanced and holistic approach. Each person in our care gets a personalized treatment plan that includes multiple evidence-based therapies. Clients who need medication work with our experienced staff and psychiatrists. If you're curious to learn more about Lightfully's treatment programs, reach out to our super friendly admissions counselors. They're amazing. We'll take the next steps together towards the fullest, brightest version of you.